Hello friends, welcome to our channel PKR Vibes Career and Growth. First of all, thank you so much for your time to spending here to learn something new today. Today we will discuss about AR caller job roles and responsibilities in our healthcare domain or in our uh, healthcare industry or in our medical billing. So for example, if you are looking for AR caller job in our healthcare domain, what kind of skills you require, basic skills, and we will discuss those kind of skills in our video today. And generally, if you are, for example, you selected as a AR caller, there are a what kind of job descriptions are there to perform daily. So daily task, what kind of daily task you should have to do, and so what are the analytical skills, what are the denial management skills, everything we will discuss in this video. So before that, I'm requesting you, if you are watching our video first time and if you're not yet subscribed, could you please subscribe our channel PKR Vibes Career and Growth and hit the bell icon so that turn on the bell icon so that you will get every our video as a notifications to your mobile or your desktop, so that it will, if you are a turn on and if you are a keep on watching our videos, so that it will be reaches to other people who are looking this kind of content. So could you please do subscribe now only. Okay guys, before we are discussing about AR caller job roles and responsibilities, I would like to discuss about three pieces of healthcare domain. Why? Because this is very useful to the new joinees or otherwise the new people who are looking for healthcare domain jobs. See, because if you are not understanding the small basic this concept, there might be get some confusion. So that is what I am repeating, and also I discussed this thing in previous videos, which is like denials. But I would like to discuss this thing. Why? Because you should have to get confidence more if you are understanding the concept thoroughly. So okay, here the three pieces are nothing but first piece is we can call it like patient, second piece we can call it like provider, third piece we can call it like a payer. So here I would like to tell different terminology of these three pieces also. The patient is also known as a policy holder simply, and also known as a subscriber or member we can call it like also. So here the provider is known as a doctor simply, we can call it like a doctor, but in healthcare terminology he is known as a provider, and we can call him like a rendering provider. Why? Because he is giving, he is rendering services to the patient. So that is what we can call it like a rendering provider, or also we can call it like a physician. And payer, third piece, payer is also known as a insurance and also known as a entity. So here we will discuss what is patient. Patient is nothing but policy holder. If policy holder feeling not okay, for example, is not okay means he got some disease or injury or nothing but he is not okay, then policyholder is known as a patient because he has a symptoms, nothing but he is not okay. So in medical terminology, the symptom of that particular disease is known as a diagnosis. And there are a medical coders in our healthcare domain. They are tell that diagnosis, the symptom of that disease in a code is known as a diagnosis code. So generally we have to understand that patient is nothing but the person who is not feeling okay. So here the patient will consult a doctor if he is not feeling okay. Here the definition of provider is nothing but who is rendering or nothing but who is giving treatment based on that particular diagnosis to the patient is known as a provider. So simply in our terminology, basic terminology is nothing but provider is nothing but the doctor or a person who is giving treatment to the patient is known as a doctor or provider, we can call it. So here doctor whatever giving treatment to the patient is based on based on that diagnosis symptoms. So the diagnosis symptom is known as a diagnosis code, and whatever the treatment given by the doctor to the patient based on the diagnosis is called as a CPT or procedure code in our medical terminology. So coming to third piece, payer. Your payer is nothing but who is giving medical benefits to the doctor in the form of payments. And also sometimes we can call it like who is giving medical benefits to the patient, because here giving benefits to the patient or doctor, that that is called, that entity is called as a insurance. So just we have to focus here. So whenever patient is feeling illness, he will go to the doctor, doctor give the treatment. After that, on behalf of doctor, there is a billing department. They will submit that whatever treatment is given by the doctor to the patient information on a medical claim forms. They will submit this medical claim forms along with the information of a service whatever given by the doctor to the patient to the insurance companies, because the doctor need to get payment from the insurance company whatever the service taken by the patient to the patient from the doctor. So if medical claim form is submitted to the insurance, then insurance will receive that medical claim form, and they will read and they will understand whether these benefits are correct or not. Based on payer guidelines, they will finalize the claim into the payment to the doctors. That is the okay, that is the situation, one situation. Sometimes what happen, insurance will receive the medical claim forms from the doctor's office or doctors on behalf of doctors. There is a billing office. So insurance receive the claims from the billing office. They will process the claims and they will not give the payments to the doctors. They are giving the denial. They are not giving the payments. Why they are not giving the payments? They will tell to the doctor in the form of denial codes on a explanation of benefits. So simply they are telling that we are not giving the payments on this particular kind of this particular kind of claims, and they will give the reason on a one PDF. It is called as a EOB, explanation of benefit. So this EOB is received to the doctor from the insurance. Why they are not giving the payment? If they are giving the payment also on that explanation of EOB, they will tell that this claim was paid. So if the payment is received or the payment is denied, is represented on a EOB, explanation of benefits, that is given by the insurance company to the doctor. So here simply an overview, I would like to tell that insurance will give the payments and also denials. So denial means the insurance is not getting the payment from the, doctor is not getting the payment from the insurance companies. Then AR caller job is working on the denial and making the denial into the payment to the doctors. That is AR caller job. So simply I'm telling you the nature of the insurance is mostly they will give the payments, it's okay, but most of the part is they will deny the claims because of multiple reasons. There are multiple reasons, and the reasons, if the denial is we are getting from the insurance, then it is known as a completely we are not getting the payments to the doctor, then we can call it like a denial. Here there are multiple reasons of a denials. I already given the playlist. There is a health AR denial management, insurances, what kind of scenarios are there. Every scenario I given with the reason and what kind of action we should have to take. So but I'm telling again, the nature of insurance is to deny the claim, but AR caller job is to make the denial into the payment. So that is a AR caller job. The vital and very very important thing is making denials into the payments. So that is our job role, and in next slides we will discuss all jobs, responsibilities, and what kind of roles of AR caller. Okay guys, now we are discussing about AR caller job role. Here the I given 3 points. The first point is basic working knowledge of a computers like MS Office, Excels, and because we have to work on Excel generally, basic Excel knowledge is required. How to enter and how to open Excel, how to rename Excel, and how to reporting your data to the next levels in a Excel, and also how to create folders and how to access folder, and how to rename, and how to keep all data in our respective folders in your respective path. So in that way you should have to awareness about a basic knowledge of a computers, and also email access. For example, you are working in any organization, for example you want to contact with your next level supervisors. At the time you should have to understand how to open your email box, and how to read, how to understand, how to send an email. So like how to how to draft an email. This kind of basic awareness you should have to know if you want to apply a job for a AR caller. And the second point is good communication skills. And the basic and good communication skills I'm telling. So communication skills in the sense, how to written skills, for example, would you like to document some data, and also would you like to send an email, or would you like to represent ideas to the some other people. You should have to have a good written skills, and active listening skills. For example, as a AR caller you are working, and you should have a good listening skills. And for example, your job, AR caller job, is you should have to call to insurance companies. So at the time you should have to talk in a good and polite way. So the conversation, how to start the call like professionally with your, for example, would you like to start a call, you should have to mention a greetings while you're starting your call. And for example, if you are ending the call also, you should have to uh, tell them some professionally, like in greeting way. So like you should have to start and end the calls, daily calls, in professional way. And and also you should have to have a knowledge on uh, documenting data while you are calling to the insurance. So you should have to practice if you don't have that skill. For example, you are talking over the phone, while conversation is continuing, you should also do simultaneously documenting that same information in your Excel book. So that kind of skills, are basic skills, are required if you are applying job for a AR caller. And also a third point is data analytical skills for analyzing the claims. Simply I'm telling, if you are working in healthcare domain in medical billing, and so we should have to understand medical claims form. For example, you are working on a claims, you should have to understand what are the terminology, and what are the claim, what is the claim form. And if you submitted a claim to insurance, what happened? So insurance is given any response back? If it is given, what is the response? So you should have to understand the terminology and the meaning, so that you should have to have identifying skills you should have to require if you are applying job for a AR caller. And also, for example, if any reason is coming from insurance, why they are not giving the payments to the doctors. So what is the reason, and how many times the reason we previously we got, and how we can stop that denial, and how we are getting payments on a denials to the doctors, how we can prevent that kind of denial from insurance, and how we can take, how we can correct that previous whatever we sent, we are not getting on previously if you are sending, but now you should have to correct that information to make payments to the doctors and from the insurance companies. So simply what I'm telling is, you should have to understanding uh, preventing it items, or preventing things, and you should have to take a corrective actions to prevent that kind of uh, denials from in future from the insurance. So simply you should have to identify the reasons of a denials, and you should have to take corrective actions to avoid the denials in future from the insurance companies. So simply you should have to understand basic data analytical skills to get a air collar job. Okay guys, here again I am telling, simply, whenever patient is feeling ill, he went to the doctor, and doctor will give the treatment to the patient, and on behalf of doctor there is a third party team, billing team. They are submitting the medical claim forms of that particular patient, whatever seen by the doctor. So they submit that information in the form of medical claim forms to the insurance companies, and insurance company is deny, means they are not giving the payments to the doctor, and they sent one explanation of a benefits to the doctor's office, and clearly they will give the reason why they are not giving the payment to the doctor. Then it is called as a, I mean, provider payment is zero, nothing but it is a denial. They are telling denial reason also. Then our AR caller job is to call to the insurance companies. So you should have to how to get the denial clarification. So at the time, what kind of documenting, I mean, what kind of records and what kind of documents you should have to open and ready, and to ask the insurance representative over the phone call, we will discuss now. See here, at the time, whenever you are ready to call to insurance companies on a medical claim form, I mean on a medical in healthcare domain, as a AR caller, you should have to open some basic prerequisites, like basic uh, documents. While you are while you are calling to insurance companies, you should have to open this kind of information on your computer. So first one is workbooks. Workbooks means, for example, the daily work allocation. So your supervisor will give you 40 or 50, example I'm telling 50 claims to you. You should have to open that workbook. It's nothing but what allocation, generally it is called as a allocation. So allocation sheet, I mean nothing but whatever they are, your supervisor is allocated to you, your job, like there are 50 claims, medical claims. You should have to open that Excel of book of allocation. So nothing but we can call it like a your daily workbook. So you have to open that Excel, you have to ready with your account while you are calling to insurance companies, and you should have to open medical claim form of that particular account. And also you should have to already, I think you already entered that in your software. There is, you will get that account information. At the same time, you will open the medical claim form. For example, you are working on a CMS 1500 claim form. So at that time you should have to open CMS 1500 claim form on your computer. For example, if you are working for a hospital billing, UB4 claim form, then you should have to open that respective UB4 claim form while you are calling on that respective account, respective account to the insurance companies. And for example, you are already working for some specialities, right? For example, there are a multiple specialities. For example, if you are working for nephrology, or if you are working for radiology, whatever it is, your client is giving some updates to your supervisor. At the time, there is a one tracker they are maintaining, it is called as a update tracker, whatever we are received from our client to our supervisor. At the time, you should have to open that update tracker in your while you are calling to insurance companies. Everything should be ready, and also some other necessary, for example, claim is denied, you have a denial reason, and based on denial reason you should have to be ready with question. What question you should have to ask them? You should have to ask necessary question. I mean, for example, claim is denied for duplicate submission. We already got payments previously, but other user already submitted the claim again incorrectly. So at the time insurance is denied the duplicate claim. Already we give the payment first time. Now you are submitted claim again. So we are deny the claim as a duplicate. So at the time, as a AR caller, your job is to ask them what kind of questions you should have to ask on a duplicate scenario. That question should be ready. So while you're calling to insurance, you should aware that what kind of question you should ask on that particular scenario. For example, I've taken duplicate. So on duplicate scenario, what kind of questions you need to ask, you should have to be ready before calling only. So during the calling, you should have to probe right information. So there is, so see, some people are calling to the insurance but they are not getting the right information over the phone call, and they are calling for the right information. So my suggestion is, if you are calling to insurance, you should have to document, or at least you should have to aware what kind of information you need to ask, and what kind of information you need to get, and what kind of information you should have to probe. If you feeling you are correct but insurance is wrong, at the time you should have to probe that correct information over the phone call, that we are submitting this claim, this is why we are submitting. This is like, for example, I'm telling this is not a duplicate because the service is different. So for example, I'm telling simple way, this is not a duplicate claim. We got the payment previously, but the doctor is given service again at the afternoon session. Morning session one treatment was done, we got the payment, but this is the claim about the same doctor only, same patient, but service is again given by the doctor at the afternoon session. So it is a repetitive service. So that is what we are submitting the claim again. So we want payment. How you are telling, for example, any modifier is appended on claim, you should have to probe that information, right information. So that is what AR caller job. So here you should have a ready with your questions and right probing information with you. So that is the point I would like to explain in this slide. Okay guys, while we are discussing about AR caller job, and while you are calling to the insurance companies on your medical claim forms, we should have to follow the HIPAA guidelines. HIPAA means your Health Insurance Portability and Accountability Act. It is abbreviation for HIPAA. And again, I'm repeating, it's very important. Health Insurance Portability and Accountability Act. It is a compliance kind of thing. Means, we need to maintain compliance and regulations, nothing but security. So because health insurance means, this is the, there is a complete information about the patient, about the provider, and also addresses, respect to insurance addresses, provider address, provider NPI tax IDs, and patient home address, phone number, date of birth, along with the gender. Every detail will be on your respective practice management system, PMS. So your job is to maintain compliance while you are working on a medical healthcare domains. For example, you are calling to insurance companies, you are providing patient information. Your account is one, but you are providing some other patient information instead of you are giving correct information. At that time, it will be leads to compliances. For example, you are calling to some other insurance and you are providing some other information. And also, for example, if you are calling as a AR caller to the insurance companies and you are talking, instead of denial, you are talking some other information. Like, and also if you are not talking in a polite way, or sometimes what happen, you you should not ask some other provider information over the phone call for this provider. So yes, obviously they will not provide that some other provider information over the phone call, because they will follow HIPAA guidelines. But we should have to aware what is HIPAA, and what questions we will not ask, and what questions we should have to ask, and there are limitations and regulations about the medical information. So here again I'm telling, we need to follow industry standards in all communications and documentation. This is very important. There are some uh, way how to talk, how to close the call, what kind of documentation you have to request in your tone, like polite tone. So we should have to follow that communication guidelines as. Here HIPAA compliance is a set of federal regulations and restrictions and limitations that protect the privacy and security of patients health information. So simply in healthcare domains or companies, they will known as a protected health information (PHI) and HIPAA. While you are joining to any company in healthcare domain, as per HR policy, they should have to give the compliance test, or they would like to give the training on HIPAA and PHI information. So there is no need to worry while you are working on a AR collar. It's just we have to aware that okay, there are a HIPAA and PHI policies in healthcare domains. If you want more information, okay, it's good. Just Google it. Just aware that thing. However, if you are joining to any other company in healthcare domain, definitely HR team will give the compliance test or compliance coaching. They will give basic awareness about this medical protecting data information. Okay guys, if you are looking for AR color job, RCM tasks are very important. RCM cycle management steps are I given information in a charts, right? So that every step is important if they are asking about RCM steps on interview call. So just you have uh, you have an idea about what are those, and I will explain now. Before that, I would like to tell what is the purpose of RCM. RCM is nothing but it's like a process whenever patients schedule an appointment to consult a doctor, and it is starting RCM process is starting when patients schedule an appointment with the doctor to get the treatment, and it will end, the process will end whenever the doctor received the payments or revenue from the insurance companies. So that is why it is called as a revenue cycle management. So in that management cycle there are many steps. That steps beginning whenever the patient schedule an appointment with the doctor, and that RCM steps end, I mean it will be completed whenever the doctor got payments from the insurance companies. So that is the process, that is process of RCM, and the purpose of RCM is to get the payments from the insurance companies to the doctors. In this process we have to reduce the errors. So if we have some error in any step, then it will be delay of getting the payments. If you are getting delay payments, the insurance companies will deny the claims that we are not received in the time frame. Like that, doctor will not get the payments if there are any errors. So finally what I am telling is the purpose of RCM is to reduce the errors and to increase the dollars, I mean payments to the doctors. And payments is also known as revenues, also called as a benefits also. So generally doctor will get benefits from the insurance companies, and patients or policy holders will give the premiums to the insurance companies to get the benefits in from the doctors in the form of treatment. But finally doctor will get the benefits in the form of payments from the insurance companies. You have just keep idea. Okay, now we will talk about the steps, RCM steps. The If you are working as a AR caller, I'm again telling, if you are working as a AR caller, the patient scheduling and transcription steps are not important, because this is not related to that much to the AR calling. And coding also, you're not in-depth coding is also not required for AR caller. But if you need assistance from a coding team, definitely you should have to task to coding team if you are working as a AR caller in your daily jobs. And charge and demo entry also, not that much, too much thing is not important to AR caller. But if it is required to enter some details of insurance and as per over the phone call, then you should have to enter the details into the system of that PMS. So in that cases it is required. So coding and charge entry a little up, or 10% is important for AR caller whenever assistance is required. Here patient scheduling, I would like to explain all the steps in because you should have an idea. Patient scheduling is nothing but patient will schedule, for example, whenever policy holder feeling illness, I mean whenever he got disease, at the time he will schedule, uh, uh, I mean he will schedule to consult a doctor. So that is called as a patient scheduling. So how we will consult a doctor, either through walk to the doctor's office or hospitals, or otherwise he will call to the doctor and I will schedule to appointment to consult a doctor about his disease or his uh, uh, symptoms of that illness. So here the purpose is patient scheduling is nothing but just schedule an appointment with the doctor. Transcription is nothing but, whenever the patient scheduled, I mean whenever the patient consulted a doctor, so while there is a discussion happening between the doctor and the patient about the illness and also treatment. At the time, whatever the conversation is done, that should be that should be written in a text format. That should be, I mean recorded, that there is a conversation happen between the doctor and patient, that should be recorded whenever patient scheduling, right? That conversation is might be recorded in a voice format. That voice format converted into the text format. I mean they type whatever the conversation happening into the paper, in the word or in the text format or in the PDF formats. That will be known as a transcriptions. So whatever the conversation happening about the treatment between the doctor and patient, that should be entered into the text format is known as a transcriptionist. The person who is doing the job is known as a transcriptionist. The process is known as a transcription. So I think that is just aware that that is more than enough. And coming to the coding, for example, there is the patient have some symptoms about his disease or her disease, that is known as a diagnosis, right? In medical terminology it is known as a diagnosis code. So based on the diagnosis code, doctor will give the treatment to the patient. It is known as a, in medical terminology, as a procedure or CPT, current procedure terminology. So and also there are some other service details like place of service, modifiers. So these all things are in the form of codes. So for example, there is a evolution and management service, ENM code. There is a evolution and management conversation happening between the doctor and patient. That should be like 30 minutes or 60 minutes. For example, 60 minutes is there. So at the time the coder will give that detail, whatever happening conversation, text, everything into the code. Example 99215. So here the CPT is 99215, telling that it is a ENM code which is happening between the doctor and patient or patient family. That will be given as a simply 99215. So here insurance will understand by seeing this code 99215 that okay, there is happening ENM code, ENM performance was done between the doctor and patient about this treatment. So there is a diagnosis code. By seeing the diagnosis code, DX code, the DX code and the CPT code, by seeing these codes, the insurance will understand that this is the diagnosis, this is the treatment. So here they will simplify that text format into the code format, alphanumeric codes, CPTs and diagnosis. I will provide the link for the what is CPT code, what is diagnosis code in this video of the first comment. Could you please explore if you want more information about the formats, and also uh, in-depth more details about the CPTs and diagnosis. So simply you should have to understand that the text format should be minimized to the code format, that is known as a coding process or coding. The person who is doing performing that job is known as a coder. So just 1 minute, sorry. So that is known as a coder. So here we have to understand that, okay, if you are working as a AR caller, you need coding assistance. Just you should have to task your claim to coding team, that is your job, that's it. But what kind of code they should have to append, what kind of modifier they should have to append, what kind of code they need to build, or what kind of diagnosis they need to change, that is coder responsibility, not AR caller responsibility. Keep in the mind. Okay, coming to the demo entry and charge entry. So this is there is also team for the demo and charge entry team. So for example, if you are working as a AR caller, you are not supposed to change demographic details of a patient. What is SSN, what is the address, all that kind of details should be done, reviewed. I mean, review should be required. So there is a demo and charge entry people, they will verify the patient demographic documents and insurance documents and other consent related documents. By verifying those documents, they have a access to change the insurance information in a respective doctor's practice management systems. So that is what, there is a specified team is there, charge entry people. They will have that kind of access to change the patient demography and insurance details of that particular providers. So I'm telling, we have to understand that, okay, for example, what is demo entry charge entry, I will tell. There is a every doctor have their billing software, is known as a practice management system, PMS. So in the practice management system, the patient details entered into the software, and at the same time the service who are giving that doctor details are also enter into the software of that respective PMS. While 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 a person is giving the demo entry details and charge entry details, one number is generated. That number is known as a account number. So whenever you are working as a AR caller in Excel, they will give you 40 or 50 claims you should have to daily job. At that time, there is a account number. Whenever you are giving that account number in a doctor software, then you will get that patient details and the patient service whatever taken by the doctor, that kind of details you will see on software. That is called as a account number, that is generated by the charge entry and demo entry people. So that is just overview, that is more than enough to know about the charge and demo entry for the AR caller. Okay, now the next one is claim submission. Okay, patient scheduling done, transcription done, coding is done. Now demo and charge entry people, everything is done, account number is also generated, everything is there. Now now there is a billing team on behalf of doctor, because doctor will give the treatment to the patient. Doctor directly not submit the medical claims to the insurance, because there is a no time to doctors to submit that claims to insurance companies. So on behalf of doctor, there are other departments, third party departments, like billing department, example I'm telling, coding department, demo and charge entry department, transcription department, like that. There is a billing department. So the billing team, what they do, they will check everything is proper or not. So they will enter these all service details and demographic details of a patient and a doctor details, and every information in a medical claim form. I mean, in a medical form, it is known as a medical claim form. For example, you are got a job, if you are working for a professional billing or physician billing, then your claim form is CMS 1500 claim form. That is consisting of a 33 boxes in that CMS 1500 claim form. For example, you are selected as a AR caller for a hospital billing. At the time, it is known as a UB4 claim form. Then UB4 claim form is having total 81 field locations. So this is UB4 claim form is used for the hospital and billing, I mean institutional claim submission forms. So just what I'm telling is, claim submission to the insurance companies is done by the billing team. There are three kind of claim submissions or four kind of claims. So first one is online in portal. If you have a insurance, for example, you are working for United Healthcare Insurance, you have to submit United Healthcare Insurance or medical claim form. If you have a access for United Healthcare portal access, then you should have to submit the claim through online. And the second one is electronical claim submission. So if you want to submit the claim through electronically, so then you should have to submit the claim through electronic. So how you are submitting the claims through electronical means, the doctors have internal clearing houses. So every doctor, however, they having their respective practice management system, like that. In addition to that, the doctors internally they have a clearing houses. Through clearing houses, they will send their claims as a electronically. And third submission is paper submission, and we can submit that CM. For example, you are working for professional billing, so then you have to submit that CMS 1500 claim form through paper. Nothing but you should have to submit to respective mailing address. And the last submission is fax. Directly you should have to submit this UB4 claim form or CMS 1500 claim form to the insurance companies through fax respective attentions. So fax means it's like 10-digit number. Directly you are tasking, I mean faxing within. If you are submitting through fax, within seconds it will be sent to the insurance companies. But the thing is, it's very cost compared to other things. So which is the most easy and very low cost and very easy means, it is a electronic submission. Because if you are submitting claims through electronically, you have a proof of submission. If it is rejected also, you will see the proof and everything, it is visible. And also you can go for appeal also. If you are done within, I mean everything is accurate but it is rejected, at the time there is a proof is available to dispute. So and that is what electronic submission is, the very efficient and low cost, and most people will use that thing. So that is a claim submission. So finally claim submission will be done. That is air caller's job. For example, you are working, there is a no claim on file with the insurance. At the time you have to submit the claim. So I'm telling that claim submission is a air caller job. The first step of air job is a claim submission. So you have to submit the claim through portal, fax, electronically, and mailing also. It's a depends on a payer guidelines. And coming to the payment posting, for example, you submitted your claim to insurance companies. Insurance company is received your claim and they give the payment to the doctor. They processed, they received, I mean whatever you submitted claim, insurance is acknowledged, received, and they processed and they finalized your claim, and they gave the payments to the doctor. At the time we got a EOB, explanation of a benefits, and in addition to that also we will get EOP, explanation of a payment also, and ERA, electronic remittance advice. This kind of documents we will get from the insurance companies to the doctors whenever our claim is paid to the doctor. So it's a good, right? We are submitted claim and we got a payments, so it's a good. At the time there is a EOB is received in our software from the insurance companies. So at the time, what is the next step? We should have to payment will be posted into the software. So if you are working as a AR caller, you are not posting the payments into the system of PMS. There is a separate team that is called as a payment posting team. So the payment posting team will post the payments into the system, depend on a check amounts. So your job, if you are working as a AR caller, if the claim is paid and you received a EOB from the doctor, or sorry, or otherwise you found paid EOB in your respective internal clearing houses, then your job is to keep the I mean your job is to download that EOB from clearinghouse and place in a respective path in your path, or otherwise you should have to send it to payment posting team, so that payment posting team will read and understand the EOB, so that based on the check amount, or they will post the EOB into the software. Check or EFT amounts, they will post the payments into the software. So if you are working as a air caller job, it is not your job to post the payments into the system. Just keep in the mind, there is a separate team. That team is called as a payment posting team. So if you are working as a AR caller, again I'm repeating, coding is not your job, demo and charge entry not your job. A little, sometimes your job is nothing but you're tasking to them, that is your job, but the action on that thing is done by different respective teams. And payment posting also done by the uh, payment posting team. And sometimes there is a billing team also. If you want to change the formats of the claim submission details in depth, at the time billing assistance is also required, like that. So here again I'm telling, the major part of AR calling is the denial management and AR follow up. Now I will discuss about denial management. So right now we are, a claim is submitted to the insurance and insurance is received, and insurance got the payments, that is was done. Payment posting team, we will task the claim, that is okay. But now you submitted the claim, but insurance is received your claim, and they processed your claim, and they got they completed their processing, and they told that we are not giving the payment to the doctor, and they are telling that your doctor will paid for $0, nothing but we will not give any amount, nothing but it is called as a denial. So clearly insurance is telling that okay, you submitted medical claim, but we will not give the payment to you, because there are multiple reasons in our healthcare domain to insurance company to deny the claims. Simply I will tell, the nature of insurance is to deny the claim, but the job of AR caller is to work on the denial and make the denial into the payment. That is AR caller job. But the nature of insurance is, yes, they will give the payments, but also the most of the things, their mindset is to deny the claims. So there are small mistakes, billing mistake, coding mistake, transcription mistake, patient member ID mistakes. Many things are there if you are submitting claim to insurance. So insurance is know that okay, service is given by the doctor, that is okay, but the billing is incorrect, coding is incorrect, submission is incorrect. So the service and diagnosis code and CPT are not appropriate. Like that, they will tell multiple reasons to deny your claim. So here our job is to keep on understanding what is the denial reason. So whenever the denial, they will tell that this is a denial, how we know? As a air caller, they will give the denied EOB to the doctor, so that in doctor's respective practice management system you will see the denial if you received from the insurance companies. If you don't know how you know it is a denied or not, then at the time you should have to check your internal clearinghouse. If you found the denied EOB, you should have to good analytical skills to how to read the EOB, how to understand the EOB. So simple is our, I'm telling an overview. We have to understand the denial codes are there if claim is denied by the insurance company. By seeing the denial code, we have to understand that okay, this claim is denied for this reason. And also denial code reason below, you will see the remark code exactly why it is denied. So like that, you should have a good analytical skills and reading skills and understanding skills. So at that time, for example, some claims are there, you should have to easily you will correct that, and again you will resubmit the claims. So that is what I'm telling, denial management is nothing but you should have to understand why it is a denied, what kind of action you need to take for the denial. So guys, I already provided multiple scenarios in our channel PKR Vibes and Career and Growth. I will provide the link for the denials, few are denials, or otherwise I will have a playlist I will provide the playlist name for the denials in our first comment of this video. If you want to explore what kind of denials, just look into that thing so that you will get an overview idea. So what are the denials and what kind of action we need to take on denial? That is denial management. Denial management is nothing but you should have to understand what is the denial on a UOB and what kind of action you should have to take. Because every time, because if you are working as a AR caller, doesn't mean that every time you should have to call to insurance. If you are good at understanding denial reason and what is the action you should have to take, some denials doesn't require call, you can resubmit the claims by changing what they are required. So for example, they are asking some other additional medical records related to the service. At the time, call is not required, because if you are available medical records, then you can submit the claim directly. That is a denial management. Okay, overview I'm telling, not required more depth, so that length of the video will be increased. So that is what I will stop here. And here, AR follow up, nothing but, for example, claim is denied, there are no other sources are there, and there is a, you felt that okay, it is denied incorrectly by the insurance. So your thought is it is correct from as per my doctor wise. See, as a AR caller, always working on behalf of doctors. So if you are calling to insurance companies, you are telling that yes, I am calling from provider's office. Nothing but you are working for your doctor on behalf of doctor, because doctor will not call to insurance on medical claims because they don't have work. I mean, sorry, they don't have time. So as a AR caller, your job is to call to insurance companies why claim is denied. So, for example, your doctor billed correctly, everything is correct. At the time, your job is to call to insurance company, then tell that why this is denied. Our doctor is correct. So, whatever we appended, the modifiers, everything is correct. Could you please reprocess? Or otherwise, I want to know what is the exact reason for the denial. That is why AR caller is required, to prove that kind of thing. And sometimes what happen, you submitted claim but you don't have any information even in your doctor's internal clearing houses or doctor's practice management system. That at the time you should have to call to insurance. Yes, I submitted claim, I want to know the status about that claim, what is the claim status. So in that way, AR caller job is required. So simply you have to understand that AR caller job is to know the claim status, to know the denied status, to know the exactly reason of the denial. And if it is required, you should have to ask the necessary questions over the phone call. You should have to reprocess the claim also over the phone call. That is the AR caller job. Finally, reporting. It's a very, very, very important. It's reporting. Why? Because yes, because at end of the day, we are working under management and we are working for our client. Client is nothing but who are giving, providing this kind of project to our company. So you worked, so whatever work you done, it should be entered in your Excel sheets or in your uh, respective documents. So whatever the data is there, for example, today you have worked for 40 claims, you called 20 insurance companies. So everything they are telling that they are denied for this reason, and you taken correct action on your software. So everything is you are documented in your Excel. And finally you are telling to your supervisor or your team lead or otherwise your manager, so otherwise your client. So finally you have to show, you have to represent your data along with the summary to the management or to the client. The management will reporting to the client, and your super, you need, as a AR color, you should have to reporting this data to your higher level supervisor, nothing but your team lead. Or if you are working as a, you for example, you are working as a team lead, you should have to reporting this data to your assistant manager or manager. So your finally your manager will represent, or your manager will show this data, whatever you are collecting from the insurance company or whatever you are taking on your medical claims, everything, how much you are collecting amounts from the insurance companies to the doctors. You can be show to your client. So end of the day, our job is to complete the I mean to complete or to satisfy the client requirements. Whatever the client requirement is there, we should have to fulfill that. But finally what I'm telling is, we should have to represent our data along with the summary to the uh, client in the form of Excel sheet, or in the form of pivot table, or in the form of other representations. In if you have any additional skills, is for example chat GPT. So there is a Power BI. So these are the next versions, the next skills. Simply we are telling in the form of graphs. So finally what I am telling is, we should have to show whatever we worked to the our next level supervisors in the form of data and summary. That is called reporting. So nothing but how many claims you worked, how many accounts you got payments from the insurance companies. So simply we are telling that we are worked on denials, we make the denials into the payments, this much amount we got. So you should have to tell this data and summary in the form of representation of a pivot tables and other Power BI representations. In that way, we should have to represent our data to the next level supervisors or clients. That is called reporting. Guys, this is about AR caller, I mean RCM management cycle steps. So why I given this much of depth means, if you are working as a fresher, if you are looking for a AR caller job, you should have to aware this basic knowledge. This is very basic knowledge only. But the thing is, if you are a at least you are have a patience to complete this kind of steps, I mean that okay, you are a good at this knowledge. So this is about one of the AR caller job is RCM cycle steps. Okay guys, if we are applying for AR caller job, then we have to understand that pre-call analysis on a medical claims is also one of the skill. So here pre-call analysis means before calling to an insurance companies about the claim status, associates need to do some basic analytical skills on a medical claims. So what I'm telling is, for example, if you are submitted medical claim to insurance companies on behalf of doctors, then our job is to know the status on that particular claim. What happened, insurance is received or not? If received, did insurance is processed or not? If processed, what is the final status? Is the either the claim is paid to doctor, or otherwise either the claim is denied or something. What happened, for example, before that, we submitted, for example, electronic claim to clearing houses, through clearing houses to the doctors, I mean to the insurance companies. There are a two internal clearing houses. From our doctor side, there is a internal clearing house, we can call it. So first, whenever we are submitted medical claim, it will be passed through our doctor side internal clearing houses. For example, if there is any information is not valid or missing, at the time the clearing house will reject your claim with your doctor side only. If it is passed through your internal doctor's clearing houses, then claim will enter into the payer side clearing houses. That payer side clearing houses is known as a external clearing house. So if the claim is passed through your internal clearing house as well as through a external clearing house, then that claim will be entered into the doctor's insurance uh, adjudication system. Then insurance will accept and process the claim, receive the claim, they will acknowledge your claim whatever submitted. Then they will start processing on that particular claim from insurance side. That is known as a claim processing period. So like that, after claim processed, we will get that claim is paid or denied. So here what I'm telling is, before calling to insurance companies, we should have to check our all available sources for the claim information. Nothing but we have to check in our doctor software first, that is called as a practice management system, and doctor's internal clearing houses for the claim status, whether the claim is rejected or whether the claim is accepted by the insurance or not. So if you have a portal access for respective insurance, you should have to check in a portal. For example, you submitted claim to United Healthcare, you have a access for United Healthcare portal, then you should have to check in a respective United Healthcare portal for the claim status, because you are submitted a claim to insurance, for example through portal or through electronically, whatever. So what is the status on that claim? Instead of calling to insurance, you should have to check the portal for the claim status, so that you will get that okay, claim is received and claim is still in the process, in process. Like that you will understand if you are checking your respective sources for the claim informations. So what I'm telling, before calling to insurance, you should have to check your all available sources for the claim status, and you should have to verify. For example, claim is already denied for non-covered charges, for example. So at the time you should have to check previous payment history. So previously this kind of claims are billed or we got payments or not. So that is called, also comes under the pre-call analysis. And also you should have to verify the previous billing history. So for example, it is a claim is billed for COB related thing, or we are not covered this payer, or some other insurance telling that they are also not covered. At the time we should have to check previous billing history, how the previous claims are billed, like this is primary or the like other insurance is secondary, how the claims are billed and how the claims are processed and paid. The filing order you should also verify previously how it was done. Like that you should have to do pre-call analysis accordingly. And you should have to verify the follow-up history. For example, already other associate already worked on this claim, again you are working now, so you should have to verify thoroughly what is happened on this claim and what kind of action the previous user is taken. If it is taken right action, then what you should have to add some value to that that follow-up notes. So like that you should have to work accordingly. So you should have to verify the follow-up history, that is also comes under the pre-call analysis. And you should have to understanding how the previous claims closed for the same denial. I'm telling that, for example, right now the claim is denied, but previously how these claims are closed, like adjustment, like payment, or like some other actions. So you should have to understand the claim history in that way. So after this all kind of analysis, you can go for pre-call, I mean you can go for calling to insurance companies. But before calling to insurance company, you should have to just aware that you should have to do your some basic analytical skills on your medical claims. That is called pre-call analysis. Okay guys, now we are discussing about denial management task. Denial management is also it's a very important skills if you are working for a AR caller. Simply, for example, you submitted claim and it is a denied by insurance. You should have to identify the denial reason on a UOB, and you should have to take the corrective actions accordingly to get the payments to the doctors, because our job is to work on a denial and make the denial into the payment. That is AR caller job. See, if you are good at analysis, every denial doesn't require call to insurance and close the claim. What I'm telling is, if you are good at denials, there are a few kind of denials. For example, I given here eligibility based denials. Means, for example, policy is expired. If you run the eligibility, if you found other insurance, then you can bill to that other insurance. So without calling to insurance, you can bill to, you have to find other insurance details you build. For example, COB related, there are two insurances. We don't know who is the primary insurance, who is the secondary insurance. For example, you run the eligibility, you know that clearly they are telling that this insurance is the primary. Or if you are verified previous billing history, then you got to know that this insurance is the primary. We got the payments because previously we billed and we got the payment as a primary. Then you have to bill that respective insurance. So what I'm telling is, eligibility denials doesn't require calls if you are a good at analysis, until unless it is a very mandatory. At the time it is required, but 90% it doesn't require eligibility denials calls to the insurances. So your example also I given coding related denials. For example, any claim which is denied for diagnosis code, CPT code, or place of service, and the number of units. For example, this kind of date of service invalid. So our CPT code is inconsistent with the modifier, or whatever the diagnosis build as a primary, it is a not correct. So this kind of things doesn't require calls. If you have any update from your client, you should have to follow, or otherwise you can task to your coding department. If you are working as a AR caller, so you are not supposed to make change the CPTs or diagnosis codes or modifiers, because we are not that much good to understand the service levels on a medical records. So coders will good at review on medical necessity documents, and they will change the required uh, changes required, whatever required to change. For example, as per medical records, they want to change the diagnosis code, so they will change the diagnosis, or otherwise they want to add some other diagnosis code, they will add the some other diagnosis codes. But your job as a AR caller, if you found that any service details are incorrect or invalid, then your job is to task this AR follow up to the coding team or coding assistants follow up. That is our job. And also, so what I'm telling, if you are good at analysis, you can task to coding team. Doesn't require anything. For example, if it is already appended with the modifier, at the time you have to call and you have to probe that okay, we already appended the modifier. It is not, for example, it is an inclusive denial, primary CPT paid. At the time your job is to already primary paid but secondary denied, however we are appended valid modifier to get a separate payment, could you please reprocess? In that way it is required. But CPT are already, it is not appended but it is a related to coding scenario, then you can task to coding team. And also one other scenario I given, like update based scenarios. For example, your client is already given a particular CPT is not covered as per payer guidelines, you can go for adjustment. Then if you are finding that kind of claims in your work order, then directly you can go for adjustment, because you can mention that as per update this procedures, this procedure is not covered by the insurance. So how you know? Because if you are a good at analysis, if you are a good at update based scenarios, at the time you are tasking to these claims to respective department, or you will take the respective actions accordingly. So what I'm telling is, denial management task means doesn't require every time is a call. Some denials, few denials are there, you should have to close without calls, and they, and there are some denials you should have to take a calls. So finally I am telling is, whenever required you should have to do a call to insurance necessarily, and also you should have to avoid unnecessary calls if it is doesn't require any calls. So this is a denial management's task also as a AR caller job role and responsibility. So we know very well that patient will consult a doctor, and so based on symptom of the patient, symptom is known as a diagnosis code. So based on the diagnosis, the related treatment will be given by the doctor to the patient, that is called as a treatment or CPTs or procedures. So that was also done. Then medical billing team on behalf of doctors, they submitted the claim to insurance, or AR caller people already submitted the claim to insurance to get a payments. But we check the claims status in our practice management system, respective practice management, I mean doctor software. And also we checked doctors internal clearing houses, and also we check the respective payer portal, and we doesn't find any claim status from our end. So then our job is to call to insurance, and we should have to check the claim status. So for example, I am telling, for example, you are working to air caller job, then how to talk I would like to just mention in this year. For example, your name is, for example, you will take your name is Thomas, for example, or otherwise your name is Mike, your pseudonym. Then you have to tell like this: hi, this is Mike, I'm calling from provider's office checking on a claim status. See, for example, why you are telling claim status on over a call means you doesn't find anything with your, I mean, any information about a claim in your respective sources. Then your job is to call to insurance over the phone call. You should have to start the conversation with the insurance representative over the phone call with the same statement like this: hi, this is Mike. I'm calling from provider's office checking on a claim status. So this is the way you should have to contacting an insurance representative over the phone call. So this is also AR caller job role and responsibilities to find out the claim status over the phone call. Okay, here in previous slide we are discussing about claim status. Nothing but we don't have any claim status, I mean claim information from our sources. We are calling to insurance and we are telling about claim, we are asking about claim status. Now what happened, insurance company already they received the claim, they processed the claim and they finalize the claim to into denial. They are not giving the payment to the doctor. They are telling that payment is $0. Nothing but claim is denied by the insurance company, and the insurance company sent the denied EOB to the doctor's offices, or otherwise we will got the denied EOB in our clearing houses. So the denial EOB clearly telling the denial reason, because there is a denied code is also there, and also respective remark code is also on a denied EOB. So then as a AR caller, your job is to do pre-call analysis on a denial. After denial, you got understand that it is denied incorrectly, or otherwise you want more denial clarification on a denial of a medical claim. Then your job is to call to insurance company. That is a AR caller job. So on a denial, this is a very important job role, because as a senior AR caller, everyone are there, but they are working on a claim, still it is not resolved. But you are a senior, for example, you are a AR caller, but you are good AR caller, good analytical skills you have, then your job is to make the denial into the payment. How you will make, or otherwise at least you will get the denial clarification over the phone call. Then you should have to pick a call and you should have to do a call to insurance company to verify the denied claim status, or otherwise denied claim clarification, or otherwise what about you want to get more information about a denial clarification on a CPT. For example, CPT is denied for any, for example, timely filing denial, but you are submitted the claim within the time frame to insurance company. For example, I'm telling United Healthcare is example, I'm telling United Healthcare timely filing is 90 days, but you submitted the claim to insurance within the 40 days only, but insurance is telling that okay, it is a denied for timely filing, but you have a proof that in your clearing houses that we submitted the claim within the 40 days from the date of service. So your job is to at the time is calling to insurance company, why, what is the denial clarification, because and you, at the time they tell that claim is denied for timely filing, then your job is to tell that oh no no, we submitted the claim within the time frame. So from the date of service, the duration whenever you received the claim is only 40 days, but your payers timely filing is 90 days. Why it is denied? Then they will provide the exactly reason, or otherwise they will reprocess the claim if you if they are agreed that it is a denied claim incorrectly. So here I am telling is, if you are working on a denial clarification, you should have to start your conversation like this: hi, this is Mike. I'm calling for denial clarification, or I'm calling for denied status. Then insurance representative will directly ask you what is the claim number. Then you already have a UOB which is received from the insurance company. It's called as a denied UOB. Then you have a claim number. Then you should have to provide that claim number so that you will start and you will close the claim accordingly. So that is what AR caller job role and responsibility on a denial claim. Okay, finally, I given one very important AR caller job role in this slide, that is taking corrective actions on a claims. I mean, call it as a end actions on a claims. So you are working on a medical claim, you are calling to insurance. Finally, what you should have to take corrective actions. So you should have to take correct action on a claim so that it will be received by the payer. I mean, they will give the payments. So here the thing is, you should have to take a correct actions. Why? Because few people are working on a claims and they are taking incorrect actions finally. So it will be not resolved, right? Finally, we want a resolution on a claim. it should be resolved by the insurance company. Finally, we want a revenue from that insurance company to the doctor. That is what our motto. So here what I'm telling is, for example, here I'm given slide point is you should have to need to take end actions accordingly based on respective scenarios and denials. For example, I given here one scenario: claim not on file. CNOF stands claim not on file. So you you did follow up, or you are calling to insurance for claim status, and finally you got to know that claim is not on file with the insurance. So you should have to submit the claim again. That is your final action on a claim. So if a claim is not on file, what you will do? Finally you have to resubmit the claim, or you have to rebuild the claim again to an insurance company. So that is what our job. Example I given. Example second I given, like timely filing denial has been expired. It is a truly timely filing denial. Then what you will do? Final action, you can go for adjustment. See guys, adjustment is also called as a write-off and a provider discount, whatever it is. Nothing but insurance is not giving any payment because you are submitted the claim after the timely filing as per payer guidelines. So that is your responsibility, nothing but doctor responsibility. So doctor will adjust that whatever billed amount on that particular claim, whatever the total charge amount on that claim will be go for adjustment. That is like action. So that is called correct action, valid action on that claim which is denied for timely filing denial has been expired. And again I given like exactly duplicate denial. So for example, initially you submitted claim for the same date of service, for example January 1st of 2025 date of service, and the insurance is already given the payment to the doctor. I mean, they received, processed and finalized, and they give the payment to the doctor. But one of associate again resubmitted the claim on February 1st of 2025 for the date of service of January 1st of 2025. Then insurance received the claim, processed the claim, and they finalized into a denial. They are telling that duplicate claim, exactly duplicate claim. So after finalized, I mean after your review also, you got to know that it is a duplicate denial. Then your action on that claim is adjustment. So because we already got a payments, if you are submitting again and again same claim to insurance company, what you will get? Nothing you will get. So that is called, it is, we will go for adjustment on that particular claim. That is the corrective action on that a denial. So like that you should have to take correct end actions on a medical denied claims or medical scenarios based on that respective, I mean denial or scenario. So that is also very very important AR color job role and responsibilities. See guys, as a overview, the nature of an insurance is to deny the claims and also to give the payments to the doctors on a medical claims. So I'm telling that insurance will giving the payments and as well as denials. But AR caller job role is to make the denial into the payment. Simple. That is the AR caller job role. An overview I am telling in one word: to make denial into the payment. That is nothing but AR caller job. So here I given one point. So AR callers play a vital role in ensuring timely payment collections from denials and helping companies to maintain a healthy cash flow. So that is a motto of AR caller job. So simple that denial management is very important if you are working on a AR denial management, because there are multiple denials on a medical claims. But the thing is, you should have to aware what kind of you should have to take on a multiple denials. For example, there are so many denials are there, but you should also have at least basic aware, okay, what kind of action you should have to take for this denial. For example, denial claim is denied for non-covered, okay, what kind of action I should have to take. Claim is denied that, okay, not covered by this payer, so what kind of next action you should have to take. For example, claim is applied, not denial, it is applied towards a deductible, so then what kind of steps you should have to take. For example, claim is still in process, then what kind of action you will take in your software. Or otherwise claim is denied for coding related denials, then what kind of task you will take as a AR caller. So claim is denied like provider is not enrolled into the payer systems, then what kind of actions you will take. For example, there are a multiple denials like that. So your air caller job is to know and aware that at least you have a knowledge what kind of action you should have to take on a denial. That is called denial management. But here the motto is make the denial into the payment. That is what we here air caller job role and responsibility. Guys, if you felt content is useful, could you please like our video so that it will reach us many more needy people who are looking this kind of content. So that is that only I request a help from you. And also I'm telling thank you so much for your time, because this is very lengthy video. You are spending your time this much means I'm really appreciable. So thank you so much. Thank you for watching. Have a good health. Bye for now.